This class is intended to be informational only. Eisenhower Health encourages class participants to speak with their medical provider about health concerns. This information should not be used to self-diagnose or treat any medical condition. Welcome to the Spine Surgery Pre-Operative Education class, brought to you by Eisenhower Health. We want to thank you for allowing the Eisenhower Health team to care for you during your upcoming surgery. This class will provide an overview of a patient's journey when having spine surgery, either of the neck or back, including before surgery, at the hospital or surgery center, and after surgery. While the content of this presentation applies to all patients having spine surgery at Eisenhower Health, there are some cares provided that are specific to each surgeon that will not be reviewed today. All of our clinicians adhere to evidence-based practices that promote optimal surgical outcomes, reducing complications and lengths of stay. If after viewing you have questions that have not been answered, we encourage you to reach out to your surgeon's office prior to your surgery. At Eisenhower, every spine surgery patient is part of the wellness program. The spine surgery you are having is an elective procedure occurring in a generally well and healthy patient. Most of our patients go home either the same day of surgery or after a 1 to 2 night stay. To achieve the best outcomes from your surgery and to get the most from the wellness program, patient involvement is required. Evidence has shown that early mobilization after surgery promotes the best results. It is important to understand that you will have pain after surgery. It is unrealistic to expect that there will be no pain. Movement helps to reduce this pain. There is an entire team dedicated to your care when having spine surgery. At Eisenhower, collaboration among providers occurs throughout the entire process to ensure you receive the best care possible. Team members include the surgeon who performs the surgery, an advanced practice nurse, such as a clinical nurse specialist, nurse practitioner, or physician assistant who works with your surgeon. A nurse navigator provides support and education across the continuum. There is a clinic team that assists with care before and after surgery. The OR team includes the anesthesiologist who monitors you and keeps you comfortable during your procedure. A perioperative nurse monitors and provides support to the surgeon during surgery. If you do not go home the same day, once you reach the nursing unit after your surgery, an RN will manage your care. A nursing assistant will assist with your care. A care coordinator will assist to ensure a safe discharge plan. A physical therapist will work with you to ensure safe activity after surgery. Occupational therapy, if ordered, addresses ways to complete daily activities. A speech therapist, if ordered, will assist with safe swallowing if the patient should develop difficulty after cervical neck surgery. There are several actions you can take prior to your surgery to help ensure you are prepared. Please arrange for assistance at home, someone over the age of 18, who can help you for the first 5 to 7 days after surgery. You may hear this person referenced as your coach. You will need to have someone to drive you to and from the hospital or surgery center, and a vehicle that is easy to get in and out of. For any work or disability paperwork you may need to be completed, contact your surgeon's office and they can assist you. Smoking negatively affects your healing and adversely affects your anesthesia. If you smoke, we encourage you to quit smoking prior to your procedure. If possible, consider decreasing your daily alcohol intake, as this can impact your healing after surgery. Excess alcohol intake can affect your liver function and affect how you react to anesthesia medications. Try to wean down on alcohol use prior to surgery. Stopping abruptly can cause serious side effects. If you have any questions regarding decreasing your alcohol intake, please contact your primary care provider. Avoid dental work, including cleanings, up to 6 weeks prior to and for 12 weeks after surgery. Begin practicing proper spine precautions and body mechanics. Next, you should begin preparing your home. Designate your zone. Keep essentials at arm's length, such as a remote, a glass of water, etc. Consider chairs with armrests. Armrests provide you a supportive surface to push up off of when standing after surgery. Take actions to minimize your risk of tripping and sustaining a fall at home, such as securing non-skid mats for bath and shower, removing all throw rugs, removing or securing loose cords. Consider adding night lights throughout the home to ensure it's well lit at night. Good nutrition is important after spine surgery. Stock your kitchen and consider making meals ahead. Have healthy foods high in vitamins, zinc, protein, and fiber. Adequate hydration is very important. Minimize contact with your pets after surgery, as there can be challenges in caring for your furry family member. Take care with jumping pets, as they could cause you to fall down, and please don't allow them to sleep in bed with you until your incision is fully healed, as this poses a risk for infection. On the day of your surgery, bring a list of your medications, including the names of the drugs, the dosages, and the frequency in which you take them. Make sure to include vitamins and supplements. Do not bring your bottles of medication with you unless you are specifically instructed to do so. The hospital will provide your home medications to you while you're here. If you use a CPAP or BiPAP machine, please bring it with you. Bring a copy of your advance directive, such as a living will or pulse if you have one. Pack a set or two of comfortable, loose-fitting clothing and a pair of comfortable, non-skid shoes. Avoid flip-flops or slippers, as they can cause you to lose your balance. Pack any personal toiletries you desire to have. Bring something to do during your downtime that you enjoy, such as reading material. Make sure to bring your glasses, hearing aids, and dentures if you have them, and their cases. If you bring any personal belongings, such as a watch, jewelry, or money, please arrange for a family member or friend to take them home for safekeeping. If no one can take them home for you, ask your nurse to place them in the hospital vault. The hospital will not be responsible for patients' personal belongings or valuables. You will need to shower with chlorhexidine gluconate soap the night before surgery and the morning of surgery. Do not put on your face or genitals. On the day of your surgery, you will arrive to the hospital or surgery center. You will check in at the information desk, go through admitting, and be taken back to the preoperative area. If you're not sure where to go, ask a volunteer. Your family or friends will be asked to wait in the waiting room. When the procedure is completed, the surgeon will speak with your designated contact person if they're available. If your contact leaves the area, please ask them to leave a phone number where they can be reached. BONES is an acronym we use to help you remember the key points of your recovery process after having spine surgery. The B stands for bending, lifting, twisting, which should be avoided for both neck and back surgery. The O stands for on a bowel regimen. The N stands for need for pain control. The E stands for exit plan and equipment. And the S stands for stay active and stay safe. After spine surgery, you need to protect your spine and use proper body mechanics. Bending, lifting, or twisting the section of back or neck that's been operated on should be avoided, unless otherwise instructed by your surgeon or therapist. If you're having back surgery of the lumbar or thoracic spine, you will need to log roll into and out of bed. Make sure to turn your entire body as a unit when getting into or out of a car. Do not bend or round your back. Instead, hinge forward at the hips with a straight back or squat down. If you are having neck surgery of the cervical spine, you should not bend, twist, or lift your chin in any direction unless otherwise instructed by your surgeon or therapist. Also, do not lift anything above shoulder height. After spine surgery, neck or back, you should not lift more than 10 pounds, such as a gallon of milk or a pack of soda. Constipation is a common side effect of pain medication. You will be prescribed a stool softener upon discharge from the hospital. Do not go longer than 3 days without a bowel movement. If you are having trouble with constipation, call your surgeon's office. Please understand that you will have pain after your surgery. It's important to try and keep your pain at a tolerable level. You will need to ask for pain medication when you start to have pain, as medication is not scheduled for you. There are several actions that can minimize your pain after surgery. Taking a pain medication as needed. Icing and elevating. Repositioning and frequently mobilizing. Using meditation and breathing techniques. Remember, it's important to communicate with your nurse your goals for your pain and to let the nurse know when you're having pain or discomfort so it can be adequately addressed. At Eisenhower Health, we use a pain scale where 0 to 3 is considered mild pain, 4 to 6 is considered moderate pain, and severe pain is considered a score of 7 to 10. Many patients find it helpful to look at the FACES pain scale, shown here, when rating their pain. The majority of our spine surgery patients go home either the same day of their surgery or after a brief 1 to 2 night stay in the hospital. Your home medication list and new prescriptions will be reviewed prior to your discharge to ensure you have an accurate list when you go home. You will have a follow-up appointment that's usually 2 to 4 weeks following your surgery. You must have any equipment you may need prior to your surgery. Most equipment desired by patients is not covered by insurance. If you do not yet have a walker and know that you will need one after surgery, please contact your surgeon's office. You may also want to have equipment such as a bedside commode, hip kit, reacher grabber, or a long-handled sponge. These items can be purchased at your local retail pharmacy or medical equipment supply store. Again, please make sure you have a walker prior to your arrival for surgery if you expect to or know you will need one. Your surgeon may order a cervical or lumbar brace after your spine surgery. The decision to use a brace is based on the individual patient and the physician's clinical discretion. Shown here are examples of cervical neck braces, thoracic braces, and lumbar braces. Be active and stay safe. Evidence has shown that early mobilization improves outcomes after spine surgery. You will be up and out of bed on the day of surgery. You will need to work hard and maximize your effort with walking frequently. Please do not get up without calling for assistance while in the hospital, as we do not want you to sustain a fall. At Eisenhower Health, our goal is to get you back to an active lifestyle as soon as possible. At home, you may need to pace yourself, but continue to stay active. We encourage you to walk short household distances frequently, such as to the bathroom or kitchen. Increase your distance as you are able and as tolerated. Movement reduces pain and promotes healing after spine surgery. When active, make sure to maintain proper body mechanics and spine precautions. We encourage you to contact your surgeon's office with any questions or concerns that are non-life-threatening. If you are having an issue or concern, we want to hear from you. Call the office if you have a temperature greater than 101 degrees. If you have excessive bloody or odd-colored drainage from your incision or any increasing redness around the incision, pain that is not relieved with pain medications, new onset numbness, tingling, or loss of bowel or bladder function, an inability to void, ongoing belly pain, or if you have not had a bowel movement for 3 days or more. Many symptoms that patients feel might warrant an emergency room visit can actually be addressed by your surgeon's office. For any life-threatening emergencies, call 911. The spine surgery program includes patients who have an elective spine procedure on the neck or back and who are usually well and healthy patients that we would expect to go home either the same day or after a short 1 to 2 night stay in the hospital. To achieve the best outcomes, patient involvement and motivation are necessary, and patients must walk early and frequently. Should you have any questions or concerns, please contact our nurse practitioners listed here or your surgeon's office. Thank you for taking the time to view this presentation. We look forward to caring for you as you embark on this spine wellness journey.
Depending on the type of surgery you have, as well as your surgeon's recommendations, you might be issued a brace to wear for support and stabilization following your surgery. We have several braces to discuss, and we're going to start with the cervical collar. First, we have a soft cervical collar. Many of you have seen these worn about in the community, and they're very straightforward and easy to put on. If you'll notice the indentation of the cervical collar, that indentation goes underneath the chin. When you're putting on these collars, you want to make sure that you have a nice, secure, and snug fit, but you obviously do not want to be having problems swallowing, speaking, or breathing, of course. Our next cervical collar is going to be a 2-piece cervical collar and is known as a Philadelphia brace. It is used primarily for showering. It has a good water-resistant foam and it will allow you to shower and also protect your spine. So these 2-piece collars can be somewhat challenging to put on. If you have your support person at home, they can definitely give you some assistance, but with a little practice, it becomes relatively easy to do. This collar is very well marked. It has stickers in the front and in the back that give you the proper orientation. If it does become confusing, you want to make sure that the hole always goes in front of your throat. This collar is specific in that the front needs to overlap the back for proper application. What I like to do is to attach the Velcro, get the collar around your neck, and then readjust as needed. Our next cervical collar is also a two-piece collar. It is not marked as well as the previous Philadelphia collar from the standpoint of it telling you how and what direction to put it on. However, if you look at the emblem and the label and it is legible, it lets you know that you have it on correctly. Also, again, the big hole in the front should go in front of your neck. This two-piece cervical collar has a feature that allows you to make an adjustment for comfort and stabilization. By pulling the knob at the base of the collar and rotating clockwise or counterclockwise, the chin position of the collar can be adjusted to a desired level. Be sure not to adjust the collar to the extreme of either direction. Now we have our lumbar support. The lumbar support will be very helpful in providing stability and helping you recover and mind your precautions. In order to apply the lumbar support, you want to put it around the waist following the belt line. You want to pull the left side over your abdomen first. You want to take a breath in and then bring the right side over to secure the brace. From there, you have drawstrings that you can pull out to provide more support, a more tight fit. In order to take the brace off, again, it is just the same action in reverse order. You can pull the drawstrings, they will retract on their own, and you just undo the Velcro straps themselves. This brace can be modified slightly and to take off the rigid back piece in order to provide support as you heal, but in case you don't require as much support as you did after surgery. We are now going to discuss walking. Walking is essential following your surgery, whether it's for your cervical spine, thoracic spine, or lumbar spine. When you start walking, be guided by your symptoms and start with short household distances. If you become tired, or if you start to experience discomfort or pain, take a break. As soon as you feel better, try to get up and keep walking. As you start to improve and heal, you will be able to tolerate and walk for further distances. Some of you might be issued a walker following your surgery. If that's the case, you want to make sure that you're using the walker properly and that it is set to the appropriate height. To make sure it's at the appropriate height, when you have your walker placed in front of you, you want to make sure that when your hands are grabbing the handles, they are lined up with your hip bones on the side of your hips. In order to use the walker properly, you want to make sure that you keep the walker at an arm's length distance in front and not so far forward that you're chasing the walker, but not so close that it's impeding your walking. You want to walk with a normal, natural gait pattern and allow the walker to precede you. Next, I'd like to briefly discuss a concept known as core utilization, which essentially means to use your own muscles and engage yourself properly when performing the information that was previously discussed. For example, when you're getting up from a seated position, engage your abdominal muscles. When you stand up, engage your gluteal muscles. Be mindful of how you're positioning yourself when you're doing all of these previously mentioned topics. These things are relatively easy to do on their own, but it would be helpful to practice prior to your surgery so that you make them more second nature and you can focus on having a successful recovery. Hello, I'm here today to speak with you and to teach you some guidelines and methods to implement in order to ensure that your recovery from spinal surgery is successful. This information is very important and needs to be followed diligently in order to mind your precautions and again to recover from your surgery. We're first going to begin by talking about body mechanics. Body mechanics basically means proper ways to move in order to protect your spine and mind your precautions. Body mechanics include proper sitting and standing posture, getting out of a chair properly, getting out of your bed properly, performing tasks that might require you to lean or bend forward, squatting as well. The first move that we're going to talk about is called a hip hinge. The hip hinge is going to be a very helpful tool in allowing you to do all of the things that I just mentioned as well as mind those precautions. The hip hinge can be a very helpful tool in minding your precautions and protecting your spine. It's going to help you perform any type of task that would require you to sit down, stand up, or perform a task that might require you to bend forward, such as brushing your teeth, washing your hands, or performing some countertop work, such as chopping food or folding clothes. In order to perform a hip hinge, you want to pretend as though you're sitting back into a chair. You can start to push your hips backwards and lower yourself down, and notice that your chest will lean forward and your knees will bend. Again, notice that this will keep your back straight as opposed to bending over This will also help to protect your knees by hinging properly by keeping your knees behind your toes as opposed to dropping straight down, which is bad for your knees. Again, this hip hinge movement will help you with getting into and out of a chair, as well as minding your precautions in order to perform everyday activities such as washing hands, brushing your teeth, or any type of countertop work. The hip hinge can be relatively easily performed. You want to make sure that you do not fold forward at any point in time and that you keep your knees behind your toes in order to protect your knees. We are now going to discuss proper sitting and how to get out of a chair properly. When it comes to sitting posture, you want to make sure that you're using a chair that is sturdy and not too low to the ground. You might want to take a break from using some of your very comfortable furniture or really modern furniture that's low to the ground. Again, sitting duration should not be more than 45 minutes to an hour in time. When you take a break, it doesn't mean that you have to go and extend yourself for a long period of time. You just want to move around and break up those sedentary positions every 45 minutes to 1 hour. When it comes to sitting in a chair, you want to make sure that you are, again, minding those precautions and keeping a neutral spine. To help do so, you can use what's called a lumbar roll, which could be a pillow, a towel, or a cushion of some sort to help support your back in order to keep your spine neutral. When it comes to getting up from a seated position, that hip hinge that was previously demonstrated again will be very helpful. There are several things that you can do when getting out of a chair to help make it more successful and less bothersome. The first thing you want to do is scoot carefully to the edge of the chair. There you want to lean forward by performing that hip hinge and get your nose over your toes. From that point you can push through your legs, and if you need to, push through your arms to help assist yourself into standing. In order to return to a seated position, you would basically want to perform the same steps previously described in a reverse order. You want to back yourself up to the chair so that you know that you're in contact with the surface that you're going to be sitting. You want to start to perform that hip hinge by pushing your hips backwards, while also reaching back with your hands to grab the arms of the chair in order to lower yourself down carefully. Again, once you're seated, you'll want to use that lumbar roll behind your low back in order to help keep a good neutral posture. We are now going to discuss bed mobility and bed transfers. There is a likelihood of aggravating your spine and breaking your precautions when getting out of bed, so we're going to discuss how to do so properly. In order to get into bed properly, you want to first sit on the side of your mattress. You want to carefully lean onto your side and use your elbow and hand for support. You want to bring your legs up onto the side of the mattress so that you're in a side-lying position, and from that point you can essentially roll over onto your back. This will allow you to get into bed and keep your spine as one single unit. In order to get out of bed, again, you will perform those same steps just in the reverse order. You will carefully scoot yourself to the side of your mattress. You will roll on to your side to get in a side-lying position, and from that point you will carefully lower your legs off the side of the mattress while simultaneously pressing with your arm and your elbow in order to prop yourself up into the seated position. From that point you can perform the same sit-to-stand transfer that was previously discussed off of your mattress.